Hello, my name's Joe Johnson and I've been helping people with dental implant problems for a number of years. And in fact, in the last 2 years, I've helped over 30,000 people with dental implant problems. Now, if you're interested in dental implants in India, it's probably because you're thinking of having it done in India, having your dental implants done. I do know that compared to the price of implants in Europe, India is far, far cheaper. And in many places, the hygiene and the standard of the surgery and everything is excellent. But what I would recommend, if you're thinking of dental implants in India, is somehow check out that what that particular dental surgeon is telling you is true. For instance, are they experienced? I mean, how many dental implants have they done? If you can find an experienced dental implant surgeon, I would choose one of them, even if it costs more, because you don't want somebody practicing on your mouth. It's a lot worse than having a tooth out, and I know because I've got a mouth full of dental implants. Look, dental implants are fantastic, but they can go wrong. This is what, the first time I had dental implants, this is what I looked like after 3 days. So you can see my whole face was swollen. I was in absolute agony and I was infected with bacteria. See, what normally happens, whether it's in India, in Europe, North America, Australia, wherever you are, what will happen is this. You'll go along to the dentist. They will give you, before they even inject you, do anything else, you'll be invited to sign a load of forms. So there's a load of these forms. Basically, you're signing things saying you will not sue them, that you've been told about this. One of the things that you will sign away is that you have been told that you might get, that there could be complications, and you're not going to blame the dentist. You could get infected and you're not going to blame the dentist. So once you've filled all the forms in, they'll give you a very large dose of antibiotics, maybe 2, 3, 4 grams of antibiotic, and a drink, knock it back. They give you this because they know that the mouth is a perfect breeding ground for bacteria, and they're about to cut you wide open inside, and bacteria is going to get all over the place. So they give you a large dose of antibiotics to start with. They'll perform the surgery, assuming they perform it to a perfect standard, and I'm sure they will. And then they stitch you back up. So you might have 10, 15 stitches in your mouth. You might have to have a bone graft, because sometimes when they're putting the implant in, there's not enough bone for it to get into. Your bone's just too thin. So if you've experienced bone loss, they will give you a bone graft, which means stretching the skin, stretching your gums over it to stitch it up again. So then they'll send you home and tell you to take lots of painkillers, non-steroidal anti-inflammatory painkillers. They do help to reduce the pain. They'll also tell you to take amoxicillin, an antibiotic, or maybe metronidazole, an antibiotic, or it could be a number of them, or they could give you a combination of antibiotics. The first time I had dental implants, they gave me both antibiotics and neither of them worked. But anyway, I'll come to that. They'll also give you a mouthwash, an antiseptic mouthwash to keep swelling, to keep killing those bacteria on your gums, hopefully. And they'll give you all kinds of stuff. Now, if you go into India, you have your procedure and then you go home again. What happens then if you get an infection? Well, somebody's going to have to sort it, because it's very you can get infected. The first time I went to a very high quality dentist in this country and I got infected because it's the bacteria in my mouth had got into the wound, because maybe my immune system was a bit low or something, and I got a mouth infection and I was in absolute agony. And I tried one antibiotic, then another antibiotic, and I'd followed everything that the dentist had said. I mean, if you go on YouTube, there's a video there called Dental Implant Problems and Secrets. And that's my video, and people have watched it 500,000 times. It's a true story of what can happen. This is a remedy called Gum Doctor. You see, when the dentist antibiotics didn't work, I had to help myself. Now I've been researching into natural remedies for 25 years. And I knew that I'd helped thousands of people with gum disease and periodontal disease and receding gums and bleeding gums, because there's a blend of very powerful natural antibiotics, and I've used it for years, and it was called Gum Doctor. And all you do, you put a bit on your finger like that, and you just massage it into your gums. Well, in this case, I massaged it into the stitches. I just put it on the stitches where the implant was, implant was below, and I massaged it on. And within 2 days, my gum infection had gone. So it did what the antibiotics couldn't do. Now, I'm not suggesting to you that you don't use the antibiotics. Please do follow everything that your dentist says. But what I am suggesting is that if you haven't had your dental implant surgery yet, I would get some Gum Doctor. By all means, have your surgery, have your antibiotics, take your painkillers, you'll come home, you will feel like crap, because you will. Take the painkillers and then put a couple of drops of the Gum Doctor onto your wound every couple of hours. You will not get a gum infection. Your gums will heal quicker. Your gums will heal much quicker with the Gum Doctor remedy. So it prevents you getting a gum infection. I'll say that again. It prevents you from getting a gum infection. This is why we've helped over 30,000 people in this like this. Now, sadly, there's been a few thousand people who have got a gum infection, and eventually they found us online. I would say no problem. Get in touch. Go to teethneedgums.com. Teethneedgums.com. The website links below this video. But I will say, dental implants need gums. You've got to look after your gums. So that's why they will bombard you with antibiotics, and they might not work. So get some of this. Rub it on. Even if you've got an infection now, put it on. It does work. It'll take the inflammation out. It'll kill the bacteria. And within a few days, your gum infection will be gone. And that's it. That's how it works. And as I say, over 30,000 people now have used the Gum Doctor for either prevention of dental implant infection or to get rid of the dental implant infection after the surgery when they've got infected, and they've used this and it's got rid of it. So you can contact me if you wish at teethneedgums.com. There's an email there, there's a phone number there. More importantly, get the Gum Doctor, get it sent out to you straight away. We'll get it sent out to you straight away. teethneedgums.com. Bye for now.